Good morning, Sanbonani Minjani and Gwen Makaya. My name is Dunsani Paxti Muhlaba Mabobo. So yeah, I was just getting comfortable. So how are you guys doing today? I hope you're fine. Today I'm here to educate you guys about kidney failure. My podcast goes on from the previous podcast. Ever since I say I'm back, I didn't have the confidence or the self-esteem to come back. But today I feel like I should educate people because many people in my hood are perishing because of lack of knowledge. So I don't want to see anyone coming to dialysis. Dialysis is not a very nice place to be. So rather be prevented than treated. I mean to say. So yes, understanding kidney failure. What everyone should know what kidney failure is. Kidney failure happens when the kidneys can no longer properly filter waste, excess fluid, and toxins from the blood. Healthy kidneys help control blood pressure, produce red blood cells, balance minerals, and keep the body functioning properly. So yes, you can imagine when your kidney can't do all those stuff. It affects the whole body, your mind and spirit. Is the spirit and soul the same thing? Yeah, maybe. Yeah, it controls kidneys. Kidneys sharp. I wouldn't say it's the engine because the engine is the brain, but the kidney is the battery. Yeah, it's the battery. Come over. The kidney is the battery. When the battery is dead, the car can no longer move. You need to jump start it. You need to pull it. You need to. That's what happens. Cut dialysis. Dialysis is basically jump starting us. It's basically pulling us. It's basically helping us through life. So yes, let's go. Let's go. Let's go. Let's go. Kidney failure. What what do the kidneys do? Do you know what the kidneys does? Do you know? Or you just living there? You're happy to be alive. So today I won't be going into details and educating too much. It's just an intro about this new podcast I'm doing, I mean to say. So yes, what do kidneys do? Your kidneys remove waste and toxins. Waste and toxins. I'll take a minute for you to analyze that. Waste and toxins balance water fluids, control blood pressure, help make red blood cells, keep bones healthy, balance salt and minerals like potassium and sodium. So let's start from the top. So it removes toxins. So mine, I'll talk about me because I'm educating people about kidney failure. My kidneys, both of them dead. They're not working. When they check the GFR, I'll tell you later on the state what GFR is. When they check the GFR, it's mostly 4. When it's a normal person's kidneys, it's supposed to be 90. So you can imagine. So you can imagine my waste in my body is not being removed. The toxins in my body is not being removed. So imagine living your whole life with a toxic person. Not toxic in the body, but somebody that abuses you. Somebody that is toxic towards your life. That's how kidney failure is. You're not able to remove that person from your life because even though they're toxic, they pay what for you. I'm not sure if you understand my example, but they're being toxic in your life. So you have to cut them off. So the kidneys, they cannot remove waste and toxins. So the toxins are in my body. So I have to live with that person, that toxic person. Balances water and fluids. So my water and fluids is not being balanced properly. It's not being removed because I stopped urinating, I don't know when, 2010, somewhere there. The only time I urinate, it's only droplets. Droplets. That's it. I miss urinating. Sometimes I wish I could even urinate my bed. Yeah, you have a dream taking a piss, urinating, and then you wake up, your bed is wet. I miss that. It doesn't happen to me anymore. Yeah, but yeah, let's go on. Controlling blood pressure. My kidneys, they're not working. So my blood pressure is, sometimes it's high, sometimes it's low. But these days it's very, very, very low, dangerously low. So it's very, very low. So because of my kidneys aren't working. And then someone who has a normal kidney function, that's why when they check the blood pressure, it's 120 over 80 or somewhere on those ranges. But do not take your kidneys for granted. And you say my blood pressure, it's because I'm eating healthy, it's because I'm jogging, it's because, no. Sometimes it's because you're jogging, sometimes yes, you're eating healthy, but your kidneys are working overtime. Don't take your kidneys for granted. Come every month or quarterly, 4 times a year, to check your kidneys. When the season starts, like when autumn starts, come check your kidney to remind yourself. That's how I remind you guys. It balances fluids, as I said. It balances fluids. You guys who have a normal kidney, you urinate every now and then, even when you're drinking. I see with my friends, when they're drinking, they urinate every now and then. This one friend of mine, he says every time he drinks, once he starts urinating, it will come often. After 5 minutes, he has to go. It's a sign of healthy kidney. It's working. So even if I drink, I decide to drink now. I take a bottle of Hennessy. I take any bev. Those alcohol toxins will just go to my lungs, will go to my face, will go all over my body. Do not be filtered or anything. That's why it's not advisable for a kidney failure patient to drink alcohol or take any toxins in their body. It controls blood pressure. Yes, as I said, blood pressure. Mine now is very, very low. You can see with my eyes, it's very, very low. I don't know if you can, but they taught me to check my blood pressure via my eyes and things. So I can feel it. Even if I hold my pulse, I feel it. The pulse is not too aggressive. When it's high, I feel it. The pulse is palpitating very high. So yeah, it keeps the bones healthy. Everyone who ever wondered why my bones were very weak from the young age, it's because of my kidneys, guys. My kidneys didn't produce. I can't remember. I'll tell you in the next episode. But kidneys disease caused bone disease. So there was this one doctor. I won't mention his name. He might sue me or anything. I went to him complaining about bones. He told me, "Yo, you lucky you came to me. You have a rare, very rare bone disease. Only 2 people in the world has this bone disease. Anytime you can sit, your bone will break. Your bones are that weak. I need to start you on calcium, very high, strong, and high dosage calcium medication. So maybe your bones will recover or be strong again, but I'm not promising anything." So yes, that's why most of the time when it's winter like this, my bones are very painful. My bones, I can't sit for long. Even if I think of going to Joburg, those 4 hours are terrible for me. I can't sit for long. Once I sit for long, my bones are panic. You can see. I'm walking with crutches, not because of the accident. I would have recovered a long time ago, but because when I go to dialysis, the dialysis reduce the calcium because the kidneys are not producing the calcium it's supposed to produce because they're no longer working. So they give us calcium supplements. I chew them, but it doesn't produce the calcium the body should because that's artificial calcium. It helps make red blood cells. Red blood cells, it's where the hemoglobin, the HP, it picks up. It produces blood. That's where it produces blood. Yo, I'm feeling hot, guys. What she's. So it produces blood, the hemoglobin. So yes, the potassium, it also balances salt and potassium. So yeah, my salt cannot be balanced. My salt cannot be balanced. My potassium cannot be balanced. I have to take care of my diet. I have to take care of anything that I eat, the minerals that I eat. Salt, depends on my blood pressure. When I eat salt, my blood pressure should be very low for me to consume a lot of salt. When my blood pressure is very high, I can't consume salt because it will take higher. It will go higher and probably have a heart attack or a stroke or some sort of like that. But you get my point. You get what I mean. So I'll tell you the main causes of kidney failure and end here, so you can follow my channel. The main causes of kidney failure: this high blood pressure, very high blood pressure. I was born with a very high blood pressure. I think I can't remember the exact stats, but it was 200 over something. My blood pressure. That's what damaged my kidney. My kidney was damaged by my blood pressure because. So I'll tell you things. I'll reveal a lot as time goes on. This is just the first episode of me opening up. By the way, this episode was inspired and motivated by Sick Life thing. She's my motivator. She's everything. You should follow her on TikTok. You check her out and post. Yeah, the high blood pressure. Hypertension damage blood vessels in the kidneys over time. You see, if you have hypertension, please go check your kidneys because hypertension in due course it's a must. You'll come to dialysis. It might not be now. It might not be after 10 years, but your kidneys will eventually get tired, and you have to come to dialysis. So please check your kidneys if you have hypertension. And if you have hypertension, seek treatment. Type 2 diabetes is one of the leading causes of kidney failure worldwide. Like I said, I'll come with more information in my next episode. I don't know the types of diabetes. I only know that there's type 1 and type 2. I don't know the difference. I didn't study that far. Genetic condition. Some people are born with kidney problems or inherit disease affecting kidney function. Some people are born with it. So it's so unfortunate that some people have to come to this world with kidney problems at a very young age. So kidney failure it's very painful, guys. You can see my face. I'm sobbing when I'm talking about it. But yep, we live to see another day. We have to save life, guys. Save a lot of lives by educating people about kidney failure. We're saving lives here. So yes, genetic conditions, people that inherited kidney failure. I'm sorry for you guys. I feel for you guys. You didn't deserve it, but Somewhere in the scripture it said, "Ntababana ekombo lokakabatsara." So I'm not saying you blame your parents. Maybe it's your grandparents because it says up to the fourth generation. So, but I'm not sure. I'm a Christian. I follow the Bible a lot. I'm a very religious person. I wouldn't be here if it wasn't for Jesus who died for me on the cross. His blood is flowing over my body. So I pray every day. Even now, I feel bad for starting this podcast without praying, but I'll pray in the end. May the Lord forgive me. Infections. Untreated infections can damage the kidney. Untreated infections can damage the kidney. So if you infected with HIV and you're not treating it, you're not drinking ARVs or the treatment that the doctor prescribed, high risk of kidney failure, very high risk of kidney failure. Or any infection in your body, you have to drink antibiotics before it damages your kidneys, because the kidneys are fighting those stuff. Sometimes they get tired, they need help. They need help for antibiotics. Okay? Go check that infection of yours. Go check that HIV of yours, that HIV and AIDS of yours. Go check it. Everyone should get tested. It's a must. It's a must. Everyone should get tested. I test here at dialysis every 6 months. I get tested. But it's up to you guys. You guys should get tested every now and then. We have 3 minutes left, guys. So excessive use of painkillers. If you are addicted to painkillers, you can't take pain. You're risking yourself to kidney failures. Painkillers will or can damage your kidneys. Painkillers. It depends on the dosage, on how high. Would I say how high? How strong the painkillers are. Because sometimes they give you you just want to sleep. You don't feel any pain. But if I take that painkiller, I'll knock out and sleep. Avoid a lot of stuff. Avoid stress. Avoid life. Life is not avoidable. When you wake up, it's waiting for you but we happy. Too much use of certain medication can harm kidneys. Any medication can harm kidneys, because those medications, we don't read the side effects of medication as people, as human beings. We don't read. As long as the doctor prescribes, we take. We don't read the side effects. I do now. Because you'll find that it's not good for my lungs. I can't be having kidney failure and lung failure and a lot of things. I have a lot of things. I have a lot of problems, health issues in my body, but I cannot add on. So I have to read the terms and conditions. I have to read the side effects. So you too should read before it damages your kidney. Alcohol and drug abuse. Constant drinking alcohol constantly can lead to kidney failure. People drink alcohol without drinking water, without eating healthy food. Just wake up, full of cold, drink. No, you mustn't do that to your body. Don't do that to your body. It's not healthy for your body. It's not healthy for you at all. I'm warning you. Drink water, eat healthy food. Eat every day if it's possible. Ask for help, ask questions. Here I am, I'll be able to advise you. If I can't, I'll ask the doctor here, Dr. Nkuna. If he's not here, I'll ask Sister Nomvula. Come to Sister Nomvula, check your kidneys. Come to Sister Nomvula herself, she'll guide you. She'll guide you on the meals to take. She'll guide you on whatever to take. Come test your kidneys. I cannot express this enough. Dialysis is not a nice place to be. I see little people crying. Old men, gentlemen, strong men, they cry at dialysis. Dialysis is not very nice, guys. I'm telling you, I cannot express this enough. By watching this podcast, you might save a life. You might save your life. You might go far with me. When you go you check your kidneys, you'll find that they were already damaged. It's just that you already know. Substance abuse can slowly destroy kidney function. That's what I said. Autoimmune disease, conditions where the body attacks its own organs, can damage the kidney. I've never heard of that, but there are conditions where the organs damage the kidney. I've never heard of that. I'll research about that, sorry about that, and come back. I come back with the next episode and tell you what it is. Okay, thank you. So I won't go any further. There's many people notice the symptoms early. So I'll continue there next week. No, not next week. I don't know. Thursday. Yeah, Thursday. But please hit the subscribe button, the like button, every button that you can hit to follow for more kidney information. Ke a leboga, guys. Tsepe.